Hey everyone, Dr. Luke Pedersen here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the top things to do at home after your knee replacement surgery. So the first thing when it comes to returning home after knee replacement surgery is going to be very simple. It's going to be take it easy and be safe. And so what do I mean by that? Well, I mean make sure that you are being safe in your home and have a good setup in your home environment. So having things within reach, using a walker or a cane if you're using one still, trying to limit how much you have to go up and down stairs. So if that means having your bedroom on the first floor or sleeping on the first floor for a little while, things like making sure your bathroom is set up safe for you. That might mean having some grab bars. It might mean having an elevated toilet seat or a commode to use. Just making sure your entire home environment is set up in a safe manner. And then just being safe in general. So making sure that you're not trying to, take your big dog for a walk down the street with a leash right away. Not trying to walk down 10 sets of stairs. Being safe, being logical, and just taking it easy and resting and recovering from your surgery. The next thing is making sure that you're managing your pain, managing your swelling. So this includes taking your pain medicine as prescribed, taking any other medicine such as Tylenol or an anti-inflammatory that your surgeon might have prescribed for you. It means managing your pain through icing or using heat if the surgeon or your therapist says you can use some heat. And all the other techniques, so managing swelling using elevation, elevating the leg, using compression if that's helpful, and all the strategies to manage your pain and keep it under control, one, so that you can do your daily activities and the things you need to do, but also the exercises and physical therapy, they're going to aid in your recovery and healing from surgery. And that leads us right into the next thing, which is start moving your knee. Get it moving, get it going, start working on that range of motion. So extension, extending the knee, doing some prolonged stretches, doing some quad sets, some contractions, and also working on the bending and the flexion, doing heel slides, either laying down or in a chair, doing any other type of knee bending range of motion. Get that knee moving early on is going to be very important for your overall healing and recovery. And then the other thing you want to get moving is yourself. Get your body moving. And what I mean by this is some walking. You don't have to be extreme with it. You don't have to do a ton of walking. You don't have to do it, you don't have to go outside and go for a hike or go up a hill or anything like that. But just do some walking throughout your house. Maybe you're using a walker still, maybe you're using a cane still, and that's perfectly okay. But get your body moving, get yourself walking. Prolonged immobility, prolonged bed rest is just going to lead to a slower recovery of your knee and just your overall body and energy levels and tolerance for activities. So get your body moving and get your knee moving early on. The next thing is just be observant. So be observant of your symptoms. So what are your pain levels like? What does the knee look like? Is it swelling up quite a bit? How does the incision look? Does it look clean and dry? Does it look discolored? Does it smell or have an odor at all? Vast majority of times, whatever you're experiencing is probably a very normal thing. There's going to be a lot of inflammation and swelling and pain and stiffness, especially early on after surgery. But if you do have any concerns, be sure to reach out to a healthcare provider, your surgeon or your surgeon's office, your primary doctor, or even your physical therapist, just to check in if anything seems out of place or you want to just make sure that what you're experiencing is normal. And then the last thing is make sure you make your plans, or if you've already made your plans, double check your plans for your healing and recovery process. And what I mean by this is make sure you have all your appointments set up. So do you have your physical therapy appointments set up? Do you have your follow-up doctor's appointments set up? Do you have any other appointments? Do you have things set up for food and getting groceries, either yourself or getting a ride or someone picking them up for you? Do you have your living set up, your bedroom, your bathroom, so that you have all the necessities you need as you progress with your healing and recovery? Are you in contact with your work so they have a reasonable idea about when you plan to return to work down the road? These are all different things, and I'm sure there's many more, but make sure you have that plan, have that strategy. Planning beforehand is going to decrease a lot of headaches and worries and anxieties in the future. So get those plans set up as you're sitting there and resting and taking it easy after your knee replacement surgery. I wish you all the best with your recovery wherever you are in your knee replacement journey. Please, if you got something helpful from this, be sure to leave a like below. It helps spread this video to others. Be sure to click on that subscribe button and turn on the notifications if you want to see videos related to knee replacement surgery, exercises, frequently asked questions, recovery, preparation, everything else in between. Thank you very much for watching.